Hi there everyone, I appreciate you. Anybody that takes a moment to look at my videos or check out anything or give me feedback, totally appreciate it. Again, let's just do a quick recap of what I am, what I'm not, what I'm doing. I am a mental health consumer. I am mentally ill. I have been diagnosed with mental illnesses. I worked as a certified nurse assistant for 4 years. My certificate expired. I'm trying to get back into the mental health field as a psychiatric nurse practitioner or nurse, somewhere in that, something having to do with mental health, wherever that takes me. I'm not quite sure yet. This is all being documented in real time. I'm not a doctor. I'm not a therapist. I am never going to endorse anything specifically. I'll make recommendations, and that's kind of, the basic deal. This morning, my boyfriend was watching, YouTube videos about psych to get a grasp on whatever he was trying to figure out. And I cannot stress enough that there is a lot of good resources out there on the internet about psych, and there are a lot of not so great ones. I commonly see these videos that 5, 10, they give you a number and of different ways to tell if somebody's lying to you, if somebody's cheating on you, if somebody's in love with you, or if you do this or that, and that's not necessarily true. You always have to put things into context, and you always have to look at the resource that's given you this information. Are they credible? Are they not credible? I always go to websites that are supposed to be credible, and I have a healthy skepticism of the government, but I will go to cdc.gov to get information. I will go to NIH.gov, specifically NIMH, National Institutes of Mental Health.gov, to read research papers. I read books by doctors, cardiologists, oncologists. I read books by psychiatrists, neurologists, endocrinologists, therapists, psychologists. I read college textbooks. I try to read as much about everything having to do with healthcare and mental health, specifically mental health, but I also always want to consider, what could physically be going on with the patient, and because that's how I look at things. I might not be a nurse now, I might not be working now, I'm sure as heck not getting paid, so I definitely try to give you resources that I believe are credible or I have experience with. I do have experience with NAMI. Go to NAMI.org, that's the National Alliance on Mental Illness, and you will get names of people that you can email, and you can access local resources in your community for support groups, for classes. NAMI runs wonderful classes, especially for family members. Their family class is why I'm here today doing what I'm doing. Their support groups, I go to those. They have a lot of information about different things you can go to where you can make your voice heard, and I try to attend all of those so I can report back to the people that don't have time, or for whatever reason can't get there, and I try to evaluate them fairly. It's not to judge or criticize them. It's just, that's what my experience with that was, this and that, so on and so forth. I recommend the DBSA. The DBSA is the Depression Bipolar Support Alliance, and dbsalliance.org. If you go there, it's the same thing. They will give you lots of information. They will give you, for friends, family members, for patients or consumers themselves, whatever you prefer to call yourself. Email these people, definitely contact them. Always do your own research, people. This stuff is in your hands. So if it's affecting you, definitely reach out, because they should be able to either help you, find a local support group, find a local class, find information that's credible, or they should be able to direct you to a name that will be able to meet your needs. Make sure your needs are getting met, and don't stop searching and looking until those needs get met. As for the patient binder, I know there are videos on that. The patient binder is something that I developed because we got a lot of great information in the family class, and I was wondering if, patients or the family members were able to really apply it to their particular situation. So I'm going to make another video right after this about what the patient binder is. It is a work in progress. It needs help. I want, anybody. It doesn't matter if you are a patient, if you are a student, if you are a family member, if you are a friend. If you have something to say about psych, please let me know so I can understand, a little bit better. Maybe there's something I can add to this, because I want this patient binder to be not just, I focus a lot on psych because that's the field that I'm interested in getting in, and that's what I know the most about. But it's also, if you have a chronic illness, it should be adaptable to help anybody with chronic illness. I have a seizure disorder, so I'm always thinking about, safety, and you always have to think about safety in general with psychiatric patients, because there's, these are the people that commit suicide. These are the people that are challenging patients that, they for family members, it's extremely stressful. Give them, this is stuff that I wish that I had and used when I got diagnosed, because I definitely underestimated my illnesses. I'm like, depression, bipolar, whatever, all the things I've been diagnosed with, I totally underestimated them, and here I am today. So it's not for profit. I will happily give you all the information that you need for free, because it would be just wrong of me to charge. But mostly I just want patients right now, especially patients and family members. Let me know what do you need. I will do my best to go to all these different classes and programs, gather the information, try to put it together quickly for you. I will do that because, on a personal level, I want to be a nurse, or let's just keep it at nurse right now because that's realistic. And I want to be the best nurse possible, the best nurse out there. They admit when they need help or knowledge. They want feedback. They want criticism. They want to they will tell you that they don't know. They will give you information and resources on how to get to what you do need to know. So please, keep in mind, I had to do the social media thing because that's where people are at. That's where they're, I'm trying to contact different people, and they're like, follow me on this, or follow me on Facebook. And okay, fine. So now it's a lot easier to get a message out quickly through a YouTube video than it is through a very long email that I know is exhausting people. If you want to, email me in private, because all these accounts are public, because I want to reach as many people as possible. It is oneof1and4@gmail.com. That's all lowercase, oneof1 I will put that information at the bottom of this. I'll put my Facebook account at the bottom of this. Those comments out there, if you put comments after this video, if you put comments on the Facebook thing or on my Instagram account, those are out there for the public. So keep that in mind. If there's something personal, email me. I try to keep up on my emails, definitely, and I'll try my best to get back to you. I have a lot of different things going on in my life right now at the moment, as we all do. I understand that. So spread the word, because I see things that are going on in mental health, and if I think that there's something that could be improved on, I'm going to try to improve it. And let me be the loudmouth that, the doctors and the nurses get frustrated with. And I'm used to that. That's okay. So I'm going to make another video that will explain what's going on in the patient binder. You can watch it if you want to. I encourage you to, especially if you're a patient or a family member, you're dealing with this illness. If you have another chronic illness, please go ahead, watch it. There's stuff in there that you can use too. Basically, document stuff. Hold on to all the paperwork you get from the hospitals or from the appointments, because you never know when you're going to need it. And let me know what's going on. So check me out. Please spread the word. I need your help. I need other people's opinions. It can't just all be me. That's just bad practice. I do not know much. So let's get me there. Let's try to change things together, right? Okay. More to come. Think green. Love you guys. Thank you for sticking with me.